rainy day in Maryland, so you're missing nothing here.
Ah,
Mm.
And we're going to get
well,
snow, evidently.
We are.
yeah, I hear the weather is going to do its thing. We have beautiful sunshine here in Portugal.
Mm.
I'm very thankful for.
I'm
And
happy for you. Even though I
and
might
we are
not sound like it, I'm happy for you.
okay. And we are live, so welcome everybody to episode 2 of Spillin' and Liftin'. And this month's episode, we're going to have a discussion on the topic of addiction. And before we launch into it, let me just take a quick moment to set the stage a little bit. First of all, a couple people have asked me, how'd you come up with the title of that podcast? And the title actually stems from an old Southern phrase called spilling the tea. So we are having a conversation, spilling the tea, and hopefully the content and the context of the conversation will lift your spirit and lift your soul. So, with that in mind, I have my cup of tea.
All right now.
I have my cup of tea, and I hope you have a cup nearby. And if you don't, grab one and join in on the conversation.
Absolutely.
So, yeah, all right.
That's some iced black coffee.
Perfect.
Right.
Perfect.
I have some hot coffees.
Okay.
There you
all
go.
right.
And
So
I have
we are.
booze. No.
And
And
no.
I have
Water.
tequila. It's 5 o'clock somewhere.
Now we're talking.
It'll change the conversation a little bit.
Yeah, it does. So we are not a TED Talk. We are not a webinar. We are a conversation. So I encourage you to join in on the conversation. Please jump in on the chat if you have questions as we go along. They are most welcome. Okay. So I wanted to start by introducing our 2 guests. We're really honored and privileged to have you join in the conversation. We have Dr. Camille Woodson coming from Maryland, where it's rainy.
Rainy and ugly.
And we have Marshall, who's joining us from Philly, where I understand you all are going to be getting some.
Yeah, Maryland's weather is our weather as well.
Yeah,
Whatever you're experiencing,
I think you're worse because you're further north. Because my
a little bit colder.
brother is in New York City for the weekend from DC, and hopefully he'll make it home. I think they trained up, so.
Yeah, we finally had all the snow melt from that snowstorm after it sitting around collecting, city grime for 3 weeks, and now it's gonna snow again.
They say, but I don't know how much I trust the current weather forecasting. But they say it's supposed to, for my area, it's supposed to be 5 to 8 inches.
Yeah.
But anytime I'm from Ohio, so I know snow.
Okay.
So I'm not foreign to this, but not knowing when it was going to come, I came to my mother's today just to make sure that there wouldn't be drama of me getting from where I live over to this office. And in Ohio, you have an actual range of snow, and that's what actually happens. Like, not this. Well, it could be from 1 to 12 inches. What is that?
So
I don't know.
You don't want me to say yet again, it is bright and sunny in Portugal, and
Can you see my eyes roll inside of my head?
We're expecting it to be in the high 60s.
I hope it rains on you.
We've had that.
No, I'm joking.
Well, okay. So let's turn the conversation to our topic for the hour. And I wanted to start by looking at Merriam-Webster's definition of addiction. And it is defined as a compulsive, chronic, psychological or physiological need for a habit-forming substance, behavior, or activity. It's characterized by continued, repeated use or engagement despite harmful physical, physiological, or social consequences, often leading to withdrawal symptoms. And in reading that definition, one thing that jumped out to me is that it seems to be divided into two categories, one being a substance addiction and the other being behavioral activity. And there's, all kinds of addiction going on these days, from gambling to shopping
Oh yeah,
to
it's broad.
substance abuse. So, Dr. Woodson, what do you think of that definition?
I mean, you've got it's a larger umbrella, and you can't have addiction without behavioral issues. There's no way to pull one out from the other. And oftentimes people just want to treat it like it's an addiction. And that addiction is, well, we just got to get them off the substance. Well, even if you lock
Mm-hmm.
them in a closet, it doesn't change the drive for it. You know, the addict's brain is just different. Someone addicted to a substance, their brain is just wired different depending on how long they've been on the substance. I don't disagree with the definition. It is a working and a clinical kind of definition in there. The biggest thing is seeing it as it's not at a point of choice at a certain point. Like people just want to just stop, just say no. Remember that whole, depending
Mm-hmm.
on your age, just say
Yes.
no. If it
Yes.
was just say no, or if it was just your mother's prayers for your addiction, nobody would be on drugs because somebody is praying for somebody. I don't care what your faith is, but I think it minimizes
what's really happening.
Like you can't, it's kind of like, like for obesity, for instance. For obesity, people are like, oh, well, people are taking Mounjaro, these injectables, all these things, but they still don't want to see it as there's underlying health. It's a chronic health problem. So then they're like, oh, well, you're going to take these medications, and how long are you going to take the medications for? The same thing they say about medication assisted therapy. But if it's a chronic illness, no one asks a hypertensive patient, well, how long are you going to be on these blood pressure pills? Not never. It's never going to be asked. Or how long are you going to be on these diabetic pills? Because it's seen as a chronic illness. This is seen as an option. Like, they don't really have to do this. It's their fault. It's a sign of personal weakness is how I see it in talking to families. Because I'm in treating patients, I treat the patient, but if I don't treat that family indirectly by either providing resources or some aspect of bringing them into counseling, if you don't want if you just want someone to kick you a pill, give you a patch, or a film, I'm probably not the doctor for you. And
Yeah.
you're probably just not going to be ready for therapy. Yeah, I may work for you at
Yeah.
a later date, but today,
Mm-hmm.
because they just fix me. Well, how often
Yeah.
do you
Yeah.
fix somebody how often do you fix somebody in one visit?
Yeah. Yeah. Marshall, your challenge with addiction has not been with opioids; it's been with alcohol, correct? What are
Yeah,
your
well,
thoughts?
multiple substances. Alcohol was the
Okay.
primary, but I
Okay.
dabbled.
Was that the first one?
Alcohol was the first substance
Yeah.
that I used. Yep, and the
Very
first one that
common.
became a problem. Yeah.
And I personally think that's one of at least with opiates, you cannot go potentially where opiates are. Alcohol's everywhere. It's
Yeah.
in
Yeah.
7-Eleven. How do
Yeah.
you avoid it? It
Yeah.
used to, it's not, you can't just say don't go to a bar, because if you go in the Wawa, they probably are selling wine or something of that nature.
Some
It's
grocery
harder.
stores.
Yeah, and some
Yeah.
grocery stores, depending on where
Yeah.
you live.
Yeah. Yeah.
Yeah.
Marsha, I really would like to have opportunity to hear from you. What are your thoughts, and well, first of all, how do you handle circumstances where
Good question.
alcohol or substances are readily available in social situations, for an example?
Yeah, that's a great question, Carolyn. I have been clean and sober for about 11 and a half years now.
That's
So
awesome.
thank
That's
you
an
so much.
Fantastic.
accomplishment.
Thank you so much. I
Fantastic.
appreciate that. Early on, at first 6 months that I was in recovery, what it looked like was simply avoiding situations where drugs or alcohol would be present, right? Like knowing that I'm just not in a place where I feel safe or comfortable being around people that are drinking, people that are that are smoking weed, people that are doing this or that. Today, and you know what, it's one of the many gifts of recovery for me. And it's as a direct result of actively participating in my recovery on a daily basis. It's almost a non-issue. You know, I went out with some friends on Friday night. We went to a pub and got dinner, and a couple of them were having beers, and because of what recovery has given me, and also sort of the attitude that it's instilled in me of you know, daily vigilance and taking care of myself and what I need to do on a daily basis for my recovery. By the time I show up to a bar and people are drinking, or I'm out on the street and people are smoking weed, I may look at it like I look at a piece of cake or a donut or something, and like sort of like, oh, that looks good, but it's not it's no longer a compulsion,
How
right?
many years did it take you to get to that point?
That's a great question. It was relatively quick. I'd say within the first year. You know, in the
Really?
12-step program that I participate in, it talks in the literature about uh being placed in a position of neutrality where we're safe and protected.
Hmm.
Uh and the substance sort of being like a hot flame, and like I don't want to get burned, you know.
Hmm.
I only have that safety and that protection as long as I'm actively participating in my recovery on an ongoing basis. And for me, that looks much different than it probably looks like for other people. For me, it's a couple meetings a week, sponsoring people, having a sponsor. But if I'm doing those things, it's a non-issue. It's like I, I love my life today, and I have no interest in burning it to the ground. You know what I mean? And that was pretty
Yeah.
quick. I think as a result of being so embedded in recovery early on and really making it like the most important part of my life, particularly for that first year. It was a pretty quick thing where it was like, okay, I can be around my family and they're having some drinks. I can be around friends. I remember I went to my brother's wedding. I must have been about 2 years sober, and that was the first time going to a huge event where everybody's drinking, and I'm giving a speech, uh and it was just I remember having this realization, like, what an incredible gift that I can be here, I can be
Wow.
present, I can be sober, and it's not even a consideration that I would want to have a drink or use a drug. You know what I mean?
Yeah.
Probably couldn't even probably figure out how did I go from being way over there to I'm here like celebrating with a toast of, I don't know, sparkling water or something,
Yeah,
and I'm okay.
that's
Yeah.
exactly right. Like, it truly miraculous.
Yeah.
Yeah. Yeah. And 11 and a half years sober, that contrast is a little bit less stark. It's easier to lose sight of
How far you've come.
far I've come. Exactly right. In that
Mhm.
first 2 years, it was like, oh my God,
Mhm.
how did I get saved from the way that I was living? You know, what an incredible gift. So I try to hang on to that and like stay close to that, you
So,
know?
Marshall, I've been listening to you talk so far, and you've used the word gift
Mm,
so many
I
times.
did hear
I
that.
don't know that I've ever experienced someone with an addiction, coming through an addiction, that has that frame around
I haven't heard the term
recovery.
myself.
Yeah,
mm.
recovery in life. This is not one of the questions, but I'm going to ask it anyway. how did
Ask
you
it.
how did you get there? How did you get to this place of, you said gift, and I guess gratitude. You
Yeah.
know, you said I'm so glad I'm here. How did you get there?
Yeah, I got there by starting, the starting point for getting there is obviously entering into addiction, right? And all of the shame and despair and fear and
Mm.
guilt and terrible things that are associated with that. And then getting to that place of desperation and hopelessness, and how did I get to this place, and how can I ever get out? I don't think I can ever get out. I feel hopeless. I feel trapped. I don't think there's a way out. Going from there to asking for help, asking my parents for help, telling them what was going on with me, reaching a place where it was like, okay, I can't do this anymore. I need to ask for help. And then them being open-minded, being loving and caring and understanding, and just wanting me to get help and going to treatment. I was in treatment in 2014 out in Nashville, Tennessee for 2 months. And then I got out, and then I got heavily involved in 12-step recovery. And so the gift was, I guess, two parts. One, the juxtaposition between the despair of addiction and the joy of life in recovery. Just the juxtaposition between those two ways of experiencing life is a gift, and has given me an immense amount of perspective. Like, I don't have problems today. You know what I mean? When I really think about what my life was like prior to coming into recovery, it's like it's a piece of cake. Yeah, all I have to do is think about what my life was like when I was in active addiction, and it's like life is all good today. And then
how many years were you in the active phase of addiction?
Yeah, that's a great question. Not long. I would say from about the age of 18 until I got sober at 22. So about 4 years.
Okay.
Yeah.
Wow.
And what was what was the critical thing that happened at 22 that said that I need to do something for you?
Yeah, that's a great question. I had spent the better part of those 4 years like there was a realization around 18, like, oh, this is a problem, and I need to get a handle on it. I need to figure out how to control it. And so I spent the better part of that 4 years trying to control it, right? Trying to reduce the amount I'm using, I'm drinking, trying to get a handle on it, and just repeated attempt after attempt after attempt to control it, and inability to control it. You know what I mean?
That you didn't have control at that.
Yeah, and just reaching a place of hopelessness, and realizing like there's nothing I can do. I am truly powerless over this, and my only recourse is to ask for help. And that's the second part of the gift, was my family and the people who came before me in recovery, that were there when I came into recovery. My parents have been, and my brother, my grandma have been so incredibly supportive throughout my whole recovery. Awesome. And I realized that that's not always the case for everybody. They've been incredibly understanding, supportive, loving, and that's the second part of that gift.
Yeah. Wow.
Thank you.
Well, Dr. Woodson, I'm listening to Marshall's story, and I'm reflecting back on some conversations we've had about some of the patients that you've worked with. And it actually also piggybacks on one of the questions we had in our Q&A. What is the expected number of times a person goes into recovery?
Then, per the addiction specialist, 1 to 100. It's variable.
Wow.
It's probably 2 to probably dozens. It's very rare that somebody is going to hit that sweet spot the first time they're coming in, because usually people, especially for opiates, if I can back up to my medical school training, I went to medical school at Medical College of Ohio. And as a requirement, they make us go to an NA meeting and an AA meeting. So here I am. At the time, I'm 23. I'm sitting in, I'm 23. I'm sitting in this meeting. So I go in there, you sign in. I'd never been to an AA meeting. I'd never been to an NA meeting. I think it's wonderful they made us go. So we get there. As I'm signing in, I kind of want them to know I'm not here as an addict, because I don't know if I'm going to see this person in the hospital. So there's a little bit of shame that's associated with even going, because I look like everybody else going in this meeting. And then as I'm there, And somebody comes up to me and they're like, oh, they were like, and they introduced myself. I'm a medical student. They're like, oh, it happened to you too. You could see the look on people's face. And I'm like, no, 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 no. I'm here. I'm required to be. So everything that I'm saying just makes it sound more like I really should be there. Like I'm not proving my case any, but it did give me an appreciation for it. And as I sat there and I'm listening to the different stories, I think we had to attend maybe three AA meetings and three NA meetings. Very different tone from AA to NA. Very different. This is me as a 23-year-old. So as I'm there, I gained an appreciation for the story. Because before that, it's somebody, I think my father was a functional, heavy drinker. I don't think he had an addiction because he could not drink for some time, but a heavy partier in his 20s, 40s. He went on OptiFast, a weight loss program, realized he had fun, irrespective of if he was drinking or not, and then just stopped drinking. No, nothing else other than that. But in there, if you can look at the times, the amount of times that somebody is going to access rehab, I see it as, I always explain it to patients as, this might be our first time meeting. We could meet again in 10 years. I'll be here. Whether or not you want to come back to see me probably depends on how you feel in the interaction that we have today. Because they're being forced in there. The average patient of mine has been forced in. Either it's court ordered, which is a whole nother ball of wax because you didn't come here by choice. Your mom has brought you in. Your dad, your girlfriend, your boyfriend, whoever, your grandma is paying for it. So I don't see it as a failure if you don't hit this. If this isn't the sweet spot, I just see it as like, this is a metro stop and I'm one of the metro stops. This might be your last metro stop, or it might be at the next, it might be a DuPont Circle, might be the spot for you. And if you can see it like that and pull away the stigma, because they're like, no, no, Dr. Woodson, I'm never going to use I lost my wife. I'm like, I hear you. I respectfully hear you. And I hope that that's the case. But it might not be because there's so many forces. Like for you, you were ready. It was you driving the bus, right? If somebody else is driving and dropped you off, I think it's harder.
Yeah.
Because it's external. You're just trying to please. You're trying to make that go away.
Yes.
My mama's on my back. My wife is on my back. My boyfriend, whoever it is. And I think in the process of the treatment of addiction, then we end up okay, so I got to go to the meetings, because people will say, well, okay, how many meetings I got to go to? How many meetings do you need? And I think by not being able to prescribe, like if I say 7 days a week, they're probably going to be like, oh, I can't do 7 days a week. But it's kind of like you want a formula for it to work. And the formula is really going to be dictated or determined by where you're coming from. Is that online or in person is the question I always hear. Whatever works for you, wherever you get fed, to your point, you're saying it as the gift of recovery. You've been granted, and at a relatively young age, you didn't have to go through 20 more years of coming in and out. That doesn't minimize your pain or the suffering that you had to do it, but it also can be from support. If you just don't have, if there's a whole lot of judgment, then shame comes in, and that's then the behavioral piece of that. Because then I just want to make, and then I'm gonna alienate myself. I'm gonna not be with my family, the people who would be supportive of me, because I feel so much shame relative. This is what I hear all the time.
Yeah.
Okay.
So there's no direct answer in terms of how many times. I think it's however many times it's gonna take. And don't see it as a failure. And if you can explain that to families, then some of the judgment and all of, because again, if it's the behavioral piece, and I do want some aspect of my family or whoever my tribe is, my support network, I've got to be able to access the brain of the person who has the issues with addiction and the family. And I got to kind of merge. All of that has to kind of go together, or the person's going to continue to struggle. So some people don't want to do counseling because there's such a stigma with counseling. But,
Yeah.
AA and NA are kind of like counseling from non-professionals. Like everybody could benefit from NA or AA because of the things that you say and you do in those groups. It's not like it's voodoo or anything. It's it's a supportive network. Like, why would you
Yeah.
turn down support? And that's what
Yeah.
you need.
That we all need. I want to piggyback on a comment that came in from Celeste. And it's really kind of directed towards you, Marshall, that you are fortunate in that you recognized early on that you were in a mode of addiction. Um, what can you share with us what things were going on situationally that made you recognize that you needed to turn the corner and start on the journey of recovery? What did that look like for you? Because it seems that it
Yeah,
happened fairly early.
it did. It did. And there was a period. First time I ever walked into a 12-step meeting, I was not at that place where I was ready, right? About a year and a half before I went to treatment, I had wound up in the hospital um from drinking. I don't think I had alcohol poisoning, but it was not a pleasant situation, and my mom wanted me to go to treatment. I wasn't ready. I
Mm.
was still at that place where I'm gonna get it under
Yeah,
control
I'm gonna lick
myself.
it.
I don't need help. Yeah, I'm gonna lick it. Yeah. And I told her I don't need to go to treatment. She wanted to send me to treatment. I said, no, I'll go to AA meetings. I had heard about those. I'll go to meetings. I got it. So I started going to meetings, and with no intention of stopping, I just had the intention of controlling it, right? But to the credit of the people in the meetings that I went to, and this is similar to what Dr. Woodson was saying about, I love the analogy of different stops, different subway stops. Those people, I don't know if they could tell that I wasn't ready yet, but regardless, they were so welcoming and kind and just like happy to be there and happy to see me there. But I walked in and I was sort of like, okay, these people have figured something out. Maybe I can apply the knowledge that they've used to stop drinking to be able to control my drinking. I don't want to stop. I just want to be able to control it, and maybe there's some knowledge here I can use to be able to control it. And so to your question, Carolyn, the next year and a half after that was really an exercise in trying to just trying desperately to figure out, okay, what's the right combination? What's the right
What's the formula?
amount? What's the formula? What's the formula? Exactly right. And how do I get to that formula? And just attempt after attempt after attempt, failed attempt after another led me to this place that it talks about in the recovery literature for the program that I'm in of a jumping off place where I can no longer imagine continuing to drink and use the way that I am. But I also can't imagine stopping. I can't imagine life without it. I don't think I'm like a fish
Kind of
out of
like stuck
water
in the
without
middle
it.
of.
I'm stuck in the middle. I'm like a fish out of water without it. I know I can't live without it, but now I also have reached the point where I can't live with it. And it's to use the word again, we talk about in recovery, the gift of desperation. And that's exactly what that was. I am
Desperate.
I'm screwed. I'm
Yeah,
screwed
yeah.
and I need help.
This isn't going well.
Yeah, exactly. And so
Nothing I'm
that
doing. My
here
formula is not. My
the
formula is
I
not
haven't
working.
found the formula. I can't
Meanwhile, you're
find it.
like, okay, let me recalculate the formula. Okay, that didn't work.
Yeah. Yeah, exactly. That's exactly right. And so failing to find that formula and the desperation, just the desperation that was associated with that, it's one of the many paradoxes of recovery, that getting to that place where I could turn the corner and really want to get sober and ask for help was a result of trying everything and it not working and feeling utterly hopeless and trapped and like I was at the end of my rope, and to be frank, at the end for me, it was like I either end my life or I ask for help because I can't keep doing what I'm doing.
This is not working.
It's not working.
Wow.
That's right. Yeah.
Wow.
And thankfully I asked for help, and I am so lucky that I had a family that was in a position of caring and understanding to be able to help me in the way that I needed. I realized that's not the case for everybody who experiences addiction, you know.
I have a question. So your mom and family are probably constantly presenting you with, I think you should go into rehab. Okay. And when you heard rehab while you were still trying to figure your formula, what did that say to your brain? How did you process, like, they don't think I can do it, like, but I can beat this? Or how did your mind at the time process that?
My mind processed that. That's such a great question, Dr. Woodson. My mind processed that as, like, first of all, for me, there was truly a belief that I needed. I got to a place of dependence on alcohol and other substances because I was self-medicating for really bad anxiety, right? And so there was a core belief of, I need this. I can't function without it. I cannot breathe without it. And this isn't what everybody's addiction looks like, but it's what it looked like for me. And so when I heard rehab, it was, they're going to send me to the one place where I can't have the thing that I need in order to survive.
Wow. Yeah.
You know?
So that's like because I hear people say it as, patients say it as, like, it felt like it's punishment because even though it's not working for me, it's working for me.
It's the only thing that works better than anything else, even though it's not working.
And had you been treated for anxiety or depression, or had you tried, like, the normal pathways for being treated for that?
I had been to numerous therapists, God bless them, and not telling them the truth about my drinking, you know, just, oh, I've got this really bad anxiety. I don't know, nothing else is going on. So, and then I finally had a psychiatrist I went to. My mom was present at that session. I'll never forget it. And I'm describing my anxiety, and he's probing about, you know, substance use and other things. And at one point he says, well, you're an alcoholic.
Oh.
And I was like, wow. Okay. So I'm never coming back to this guy.
Right. This is my first and my last visit ever.
Yeah. But, but he told me what numerous other therapists hadn't, you know, seen or been willing to say. Because I'm trying to get help, but I'm trying to tell the help how they're going to help me. You know what I mean? You know what I mean? That alcohol's not part of it. I got that. Let's take care of the anxiety, and I'll take care of the drinking and drug use part of it.
Yeah, because I'm a pro in that. You stick with what you know, Doc. You know, kind of like
I'm working on the formula. Yeah.
Exactly.
I'm working on the formula. You don't understand.
When I get that formula, I'm gonna come back and tell you, because I was right.
Yeah.
But some of it was also in the, you know, I don't get offended when somebody comes in with, you know, trying to tell me what the formula is, because it's kind of typical for the it's typical for the disease process, if we'll say that.
Yeah.
Did you ever get the anxiety treated so that you didn't need to meditate, either with therapy or medication? Or how did you manage, or how do you manage in present day? How do you manage this underlying anxiety? Or was the anxiety caused from, did the addiction come first, or did the anxiety come first?
You know, it's that's a little bit of a chicken or egg thing, you know, because I started also smoking weed heavily as a teenager, and that, I think I always had some underlying anxiety, but that definitely exacerbated it for sure.
Did the weed help the anxiety for you?
No, for me, it made it much worse.
Yeah.
But I still loved it. It was a strange relationship, you know. And
there's obviously something to it. I've never done it, but my patients think very fondly of it. So
yes. So I was treated for anxiety around, for the first time, well, as a adolescent probably, but then around age 19, I went to a psychiatrist for anxiety, was dishonest about how much I was drinking, and this psychiatrist prescribed me benzodiazepines, so Klonopin. And I was on Klonopin for the next 3 years. And so then that became a whole other piece of that addiction, and it didn't treat well, at first it treated the anxiety in the same way that
Then you needed
opiates
more.
treat pain. Exactly right. Yeah, it made the anxiety disappear for as long as the pill lasted, and then I developed a dependence on that, and it stopped working. I built up a tolerance, and that was probably the hardest part of being in rehab, was with the withdrawal, not from the alcohol, but from the benzodiazepines. But then once I got into treatment, they took those away. Obviously, took the alcohol and the weed away, and I got on an SSRI. I got on Zoloft antidepressant, which had been prescribed to me before, but which I wasn't really interested in because it didn't fix the anxiety immediately, like
Yeah, you
Klonopin
needed it to
did.
that. Yeah.
Yeah,
Why are you
and I've
wasting my
been
time with this little nonsense? I
exactly
gotta
right.
wait time for it to work when I know what works.
I need
And
something
still.
now. Yeah,
Mm.
exactly right. And so I was treated for the anxiety when I went into treatment, sort of
Mm.
concurrently
Okay.
with the substance use. Yeah, and
Because
that
you're
was
kind
and
of
that was
forced to
incredibly
do it at that
helpful.
point because you're an inpatient at that point.
Yeah,
And
Wow.
exactly right. Yeah,
and you just need a long enough. I always tell patients, you just need to give me a long enough runway to get you to the point. You just kind of, because it's trust. Some of it
yeah,
is you have a relationship with the physician. Do you feel like that person gets you?
yeah,
Because if I'm just treating you as Marshall, you're a drug addict, and you're the patient at 9 a.m.,
yeah,
it feels, because patients will tell me all the time, I didn't feel judged when I came in. None of the staff treated me that way because they've been, the experience. So some of it is people will not want rehab because they have this bad experience going to offices or things like that,
Wow.
or they
yeah.
feel this judgment. Kind of like when I was in college, I took one of the residents to Planned Parenthood because she was thought she could be pregnant. We get there, I'm in the lobby, and I use this when I see patients because it reminds me. She's sitting down in the chairs. I go to the front. My father was on the board at Planned, so I knew what they did, right? I get there and I'm trying to discreetly. I'm like, we're here to we need to get a pregnancy test. Like I'm trying to say it. And the
Yeah,
lady in the
yeah,
window, she says, "Oh, we don't do pregnancy tests on Wednesday." Ah!
yeah.
Okay. So I'm like, do you not have any like empathy? So we leave there and we end up at this, I didn't know it was a pro-life clinic where the lady's like, if she's
Mm.
pregnant, she's not going to kill her baby. So again,
Oh,
why would, you know what I mean? Like, I didn't
yeah.
even know these things. At the time, I'm 18, so I'm really young. But if this is your experience and access to healthcare, why would anyone
Yeah.
want to go back to that? I don't
Yeah,
care
Mm-hmm.
what your mom says, your
yeah,
grandma says. So
yeah.
if you can find some place that's like treats you as a human, it's a little
Yeah.
easy. It's still a hard because you still got to establish trust,
Mm-hmm.
right?
Yes.
You still have to establish trust, and that takes time. And you don't want to be seen, like you said, when the psychiatrist said, "Well, you're an alcoholic," I know you were like, have you been following me around? Like, did my mom say something? You're probably trying to figure out how did they come to this?
Yeah,
But you told a story
yeah,
and they're just connecting the dots of the story. But
yeah,
self-medication for opiates is the same.
yeah.
They do this. I mean, I have patients now. I'm not even touching the weed. I am just dealing with the opiate.
Mm.
Yeah.
They haven't had a whole lot of success. This one patient of mine hasn't had a whole lot of success in treating anxiety, right? Even though they've tried different medications, they've gone to psychiatrists, she got tested, then they said she didn't have what she clearly has this. So I don't know what happened at this office. So how do you treat somebody if you can't? So if I say no more weed or I'm not going to see you, well, she's
Mm.
probably going to go back to opiates.
Mm-hmm.
Yeah,
So then
yeah.
you know what I mean? And so her father's like, well, I don't think she should be doing any. I'm like, do you realize where your daughter has come from?
Yeah.
So I think acknowledging the path of how you got there. Do I think the marijuana is a problem long term? I do. But she's doing well today.
Yeah.
She's
Yeah.
doing well today, and it's defining success and being open to changing the definition of success.
Mm.
She's been a patient of mine for like 7 years. So in 7 years, I still haven't gotten rid of the marijuana.
Mm-hmm.
But she's had a daughter. She's had a daughter. She is a mom. She works, so you got to look at the other stuff. Because some people would be like, well, she's still on drugs.
Yeah. Yeah.
And she is. And in the current phase of where, I'm charging my car and people are smoking, the weed is wafting in the air at 7 a.m.
Yeah.
So, I mean,
Yeah.
it's everywhere. At least back in the day, it was like a party scene or something like that. Now it's whatever the vaping, don't get me started on it. It's the ease of accessibility, I think, to the
Yes.
point of alcohol, of us talking about alcohol addiction, at least for opiates, you kind of got to go somewhere to get something.
Yeah.
Yeah.
You know what I
That's
mean?
true.
Like,
Yeah. It feels like we're getting close to our time here.
Yes, we are.
And
We
I
are.
think if it's okay with you, Carolyn, we've got one question I would like to hear from both of our guests on before we close.
Yes. Yes, please.
This is a topic I knew it. We knew it would be. We knew it would be rich and powerful, and we just stuck our toe.
yeah, but to Carolyn's point,
in
it
the
is
topic.
I appreciate it because this has been a conversation, so I
That's
appreciate
right.
that part.
Yeah.
If there's one thing that you would hope that people would take from this toe in the topic conversation, just one thing, what would it be? And I think I'll start with you, Dr. Woodson, and then we'll move right to Marshall and kind of round it out that way. So, Dr. Woodson, just, what's the one thing you would hope people would take away?
The one thing I would hope people would take away is there are a lot of options for treatment that didn't exist before. And being open to, as we were discussing Marshall and his formula, being open to your formula or whatever may not be what your friend Sally, who had addiction issues, looks like. So don't try and judge yourself against that standard. You are the only I'm the only Camille Woodson. If I was addicted to opiates, there's no one else that's going to have it just like I. Their path may be, but a little bit different. I might have a mom and a dad who are still living, but you only have a dad that's still alive in your support network. And try your best to find somebody who sees you.
Okay.
Sees you.
Isn't that what we all want?
Yeah.
It's what we all want, but it's critical to this because
Yeah.
once you can remove the judgment, like if you called my patients, if I gave you 100 of, they'd be like, well, does she? No. I guarantee you 99.9% of them would say no. It's something I work at to provide an environment where I'm just trying to meet you where you are.
Yeah.
And we're going to have a conversation of, okay, so let me get this right. So you stole grandma's pills. All right. Okay. Okay. All right. Well, luckily you didn't go to jail. I mean, I'll always try to find something that's a positive or something to make it smile. Things could be worse.
Yeah.
Things could be worse. And if you're in an appointment, this means you aren't incarcerated. You're not hospitalized, right?
Yeah.
We're winning. There's a win. So trying to find, how do you get to the point that the person eventually trusts and sees you as the actual person who has the issue with addiction?
Okay.
And if it's not with that person, if it's not me, if it's not, please keep going until you get there. The same thing I tell them for therapy. If I send you to Sally and you hate Sally, I think Sally's great. But if it didn't work for you, Sally sucks. And let's move on.
Okay.
Marshall, could you pick up on your thoughts on Sherry's question?
Absolutely. Yeah. So I guess the one takeaway that I always try to share, whether it's in a meeting or in a context like this, with respect to recovery is, and it's Dr. Woodson touched on it, looking different for everybody, but just the fact that like there is always hope, no matter how desperate, hopeless, bleak, full of shame and guilt and despair you feel, there is always hope. There's always a way out. And it will look a little bit different for everybody. It'll also kind of look the same in a lot of ways, but there's always hope. And it starts with just being willing to ask for help.
Always hope.
Fantastic.
I like
Fantastic.
that.
Yeah.
I like that.
Me too. That's a great way to wrap the conversation, Marshall.
Yeah.
Thank you so
Yeah, I
much.
like
Of
that.
course.
Hmm.
I
Yeah,
like that.
yeah.
Yeah,
So
just keep going. Just keep
Yeah.
going. Just
Yeah.
keep going.
just
Yeah.
keep going.
Just keep going. As
Yes.
long as you are in it to try to win it, you have the
Yeah.
potential to win it.
Yeah.
Soon as you submit, because we didn't even get it because we're only putting our toe in. We didn't even have this opportunity to get to. There's high rates of suicide.
Mm-hmm.
You know what I
Yeah.
mean?
Yeah.
Yeah.
We didn't even get to any of that because this is just the baby toe
Yeah.
It's the baby
in
toe.
in
It's a
there.
baby toe. Well,
The ba-
we may have to pick up another episode and at least get the second toe
Maybe
in.
the second toe, the toe
Maybe
Absolutely.
the
next to
second
it.
toe in. But my heartfelt thanks to Dr. Woodson and
Absolutely.
also to you, Marshall, for joining and being so open and
Absolutely.
candid with this
Yeah,
Yeah.
conversation.
Thank you all.
And I hope that our audience had some good takeaways.
absolutely.
And I look forward to our next conversation. Might be on this topic or another one. But thank you again so much. We really
Thank you
appreciate your
so much.
time and your candor and your honesty.
Thanks for
Absolutely.
y'all's
So
time.
much.
It was
Yeah.
an honor to be
Thank you.
here.
Nice to
Great
meet you,
talking with
Marshall.
y'all.
And congrats on, you say 14 or 15 years?
Thank you, Doc. 11 and a half.
Oh, 11 and a half.
All right.
11
11
and a
and
half.
a half.
Well,
Thank you. I
congrats.
appreciate it. Thank you so much.
All right.
Fantastic. Thank you all for joining.
All right.
Thanks,
You guys
y'all.
have a
Appreciate
good
it.
Have a
day.
great day.
Stay warm and safe
Enjoy
in
the
Bye.
Philly.
sunshine.
Yeah, I
Right.
will.
Take care.
Bye, y'all.
Bye.
I'll get off of here.